Can safe sex prevent all STI-linked reproductive cancers? Imagine a world where a simple act could protect you from certain types of cancer caused by infections. While practicing safe sex is a crucial step in reducing the risk of some reproductive cancers linked to sexually transmitted infections, it does not provide complete protection. Consistent and correct use of barrier methods like condoms can significantly lower the chances of transmitting infections such as human papillomavirus, or HPV, which is responsible for most cases of cervical cancer. Using condoms regularly reduces the risk of HPV infection and can decrease the chances of developing precancerous cervical lesions. However, because HPV can infect areas not covered by condoms, some risk remains. Vaccination against HPV is another powerful tool. The HPV vaccine protects against the most common cancer-causing strains of the virus. When combined with safe sex practices and regular health screenings, vaccination offers the best overall strategy to prevent HPV-related reproductive cancers. It is especially effective in young people before exposure to the virus. But it is important to remember that not all reproductive cancers are linked to sexually transmitted infections. For example, testicular cancer is not caused by any infection and cannot be prevented through safe sex practices. Some other cancers, like certain throat or anal cancers, are associated with infections that may be less affected by condom use, especially since some infections can be transmitted through skin-to-skin contact outside condom-covered areas. Herpes simplex virus, for instance, can increase the risk of some cancers but is not fully preventable with condoms alone. In summary, practicing safe sex, especially with consistent condom use, can lower the risk of HPV infection and related cancers like cervical cancer. Vaccination adds an extra layer of protection. However, because some infections and cancers are caused by factors outside the scope of safe sex practices, they cannot be entirely prevented this way. Regular screening, vaccination, and open communication with healthcare providers are essential parts of a comprehensive approach to reducing the risk of reproductive cancers linked to infections. Always consult a healthcare professional for personalized advice and screening recommendations to stay proactive about your health.